our own personal health is also it's dangerous to the environment. So I'll go by this simple definition, which is, according to the World Health Organization, it says substance abuse involves the harmful and hazardous use of psychoactive substances, including alcohol and illicit drugs. Drugs, substances, is a chemical substance other than food that is capable of altering the mind, your body, the body of an individual when consumed, attacking the mood and perception. Substance use is the consumption of psychoactive substances that alters your mood, your cognition, and perception or behavior. It says substance capable of being abused. Stimulants, we have caffeine. For people who are used to taking, I had a rough night, so for me to get maximal effect during work, you indulge in caffeine. You take caffeine, nicotine, cocaine, cracks, and all. And the tricky thing about substances, you see today, when you say, okay, please make me a cup of coffee, you sustain on that. You run through that in a day. By the next day, that one cup will not be able to sustain you. You up to two. Then, before you know, you get an upgraded version of yourself. And before you know, you become addicted because you're dependent on that thing to survive. And like Dr. Bolarewa said, you're depriving yourself of sleep, which is a basic, essential need of life. And you begin to sustain yourself with caffeine, Then we have depressants. These are classes of substances. We have depressants. Depressants are alcohol, opioids, and co. For example, a sickle cell patient, that's very common in my facility. For people who have sickle cell, they go through a lot of pain. So during their crisis, when they have their episodes, most times they give them injections like Penta. So a lot of them are dependent on it. And because they know, because during this episode, I took Penta, and of course, I got small relief. Then before you know, they get friends who are doctors and things, they just give them prescriptions. They go to pharmacies, you buy Penta, you begin to take it. And before you know, it begins to tamper with your health. So those are very dangerous things to do. Then we have antidepressants. People take a lot of antidepressants, serotonin, moderators, stimulators, just because you want to probably get high or you want to feel in the mood. Then I'll go to causes of abuse. We have biological factors. So, genetic predisposition. We have brain chemistry imbalances and family history of addiction. Some people grew up watching their parents take cigarettes, take alcohol, daddy takes beer, and all of those things. And of course, when you grow up, you just say, I just want to have a feel of this. And for some people who are from, no stereotype, from like rivers and what have you, they put it's a norm for them to take alcohol and everything. And alcohol is very dangerous to our body systems. So we should know, as little as that Smirnoff ice you take, it tampers with your brain. Then I'll go to psychological factors. We have depression, we have anxiety, we have grief, we have stress. Stressors are one of the major factors why people engage in alcohol. You have environmental cues, you have emotional distress, you have social pressure, you have peer pressure. That's even on a very high rate. Then we go to social factors. We have peer pressure, we have poverty, you have family conflict, you have exposure to substance. Some people, our family dynamics are very different. A lot of people in their family, they do things a certain way. Then you go to this family, then you're saying, why is my mother like this? Why is my father like this? And your friend says, okay, come and calm down. Just take this one bottle. And before you know, you keep taking. And from there, you are dependent on it. You have withdrawal symptoms. From there, alcohol can no longer do it for you. You engage in crack, you engage in weed, and all types of substances. Then I'll go to symptoms of substance abuse. It says sudden weight change. You gain or they lose weight. Sometimes when you see a lot of people, some teenagers hide it a lot from their parents. People do not know that they take substance, but of course, I as a professional, when I look at you, I can tell, even from your tongue, from your hand, because it is what I practice. Poor hygiene. Some patients, you begin to have decline or excess increase in personal hygiene. You see those people who pay excessive attention to themselves. You've taken a lot of alcohol, so you become very aware. You begin to say, I have to be sharp, all those things. Or they have decline. They no longer pay attention to their personal hygiene. It's just this, it's just that, because of course you are engaged in other things. Then you have bloodshot eyes, we have aggression, irritability. You would realize that some people are very soft-spoken. By the time some people are timid. And of course, because I also have stage fright, forgive me, but I don't engage in alcohol. So for some people, for example, you want to speak to people, and because of your stage fright, you say, let me go and drink. I have a colleague, he's one of the smartest clinical psychologists I know in Abuja that I have met. And this is somebody that whenever he wants to talk to me, just say, Doc, give me Heineken, and he will say, use me as your patient, treat me. He's very dependent on alcohol. Even during exams or whatever, he would say he wants to engage in alcohol. That's another dependence, because he's a very shy person. He cannot face his fears. So we have neglect and responsibilities. Most times when you engage in alcohol, when you engage in substances, you begin to neglect your responsibilities. You begin to run away from your problems. Some people see substances as a safe haven because, of course, when you are high, you don't think about your life and whatever, forgetting that those problems are forever there, so which you have to address. We have secretive behaviors. Especially, this is very peculiar to teenagers and young adults. Most times when they get very secretive, don't check this, don't know this, don't know that, they're already engaging in substances. Then we have withdrawal. Sometimes, okay, for a starter, let me say, for example, you just probably engaged in maybe weed. Then after a while, because you've not taken it, you begin to have withdrawal symptoms because you are dependent on that thing. So you begin to have all sorts of withdrawal symptoms. You have mood swings. We have decline in academic or work performances. We have anxiety. We have depression, to mention a few. Then effects of substance abuse. Of course, like Dr. Bolarinwa had stated earlier, and Dr. Theophilus says, you have liver damage, you have heart problem, you have psychosis. Psychosis is very common. You have hallucinations, visual hallucinations, auditory hallucinations. They all come because that's when you see, when they have sense of danger. When you see someone over religious problems, when you see people who talk about, I'm going to church, no, they didn't pray enough in this church, I have to go to another church. Or I have a case at hand at the moment. I have a friend who relocated to Canada in 2010, and she was doing very well. She had relocated with her family. On getting there, her marriage got really rocky, and he hit the rock, and they went their separate ways. She's only with her children. And now when you go on her Facebook and things, she was a very quiet person. Now on social media, all she posts is, people are after me, after all my qualifications. She was one of the smartest people. She came out with the very best grades. However, over spirituality, it's a mental health problem. You begin to say, you see cockroaches in your house. You say, it's from my village people. Those are the problems. You have crime and violence because you begin to engage in crime, you begin to engage in violence. Poor relationship, work performance. There will be decline in your relationship with people. You want to run away because you feel everybody is after you. Then substance addiction, to mention a few. Then I go to substance addiction. According to WHO, drug addiction is a state of periodic or toxic intoxication produced by repeated consumption of drugs, characterized by a strong desire or compulsion to continue taking a substance. Like I said, you have that willingness. It's something that makes you feel good. So from taking beer, you upgrade to taking vodka, and all sorts. Then addiction is when an individual may need larger amounts of substance to get satisfied, like stimulated. From taking one bottle, that's a typical example. Tomorrow, one bottle will not have the same effect on you, then you graduate. Then from there, that's why you see people graduate to opioids and all sorts. There's even something called Zakami. In Cairo, when you are interviewing your patients, you hear all sorts. In Zakami is OSPU. when the horse poops, so they mix it with gum, and you begin to sniff it. It makes you really it takes them there, and you say, doctor, that thing took me there. And, forgetting that you're coming down from wherever you've gone to. So substance addiction is due to withdrawal symptoms. Then withdrawal symptoms occur when the body responds to reduction or cessation of a substance after prolonged use, indicating physical dependence. That's what I've explained earlier. You begin to get dependent. Okay, let's take caffeine, for example. I'm sure a lot of us take coffee. When you don't sleep, you don't do things that you don't exercise, you don't do, and of course, you have to stimulate yourself to get going for the day. Then you say, okay, let me take 2 cups of coffee for the day. And before you are dependent on that thing to function maximally. Then when you don't take it, there's a decline in your brain, there's a decline in your activity, and all sorts. Then I go to diagnosis of substance use. Substance abuse is associated with substance use disorder, SUD, are diagnosed with criteria in both Diagnostic Statistic Manual of Mental Health, that's DSM-5, and ICD, that's International Classification of Diseases. Those are the tools used by clinical psychologists to diagnose substances. Then treatment of substance use. Substance abuse can be treated by cognitive behavioral therapy, group therapy, motivational interviewing, support groups, inpatient and outpatient rehabilitation, this church awareness we're having. You can call, when during treatments, peer support, shared recovery experience, those are the supports you can give to people. For example, this kind of awareness that we're having, I'm sure some people are getting to hear a lot of things for the first time about substance now. So this is the kind of support group you can also have. Then it says preventive measures for substance use, drug education and awareness, like I said, family support programs, school-based prevention programs, community intervention programs, and of course, psychotherapy. Psychotherapy is the session you have with your psychologist. That's when you are not far gone. Your psychologist will diagnose you to know whether you need drugs, whether you need to see a psychiatrist, or psychotherapy can do it for you. And, in conclusion, it says substance abuse remains a global health challenge that affects human beings across all ages. It's not limited to age. It's so funny that when you come to child and adolescent wards, you see children 3, 4, 5, 6. Some people, they've molested them, and while they're molesting them, they give them all sorts of substance for them to be able to get the satisfaction the adults derive from children. It's extremely common. I can tell you for a fact that, at the initial stage of my career, I used to cry a lot, when I see young children and adolescents, when I see the rate at which they engage in substance use, you will really be surprised. I need us to talk to our children, to our nieces, talk to our nephews, educate them, tell them about substances. It's really bad, and the access is crazy. As bad as you going to Wuse in the afternoons, in the evenings, you just park, they walk up to you, what do you want? And the access is everywhere. Then the rising cases of insurgency, terrorism, banditry, and other social vices are linked to substance abuse of illicit psychoactive drugs. Of course, who would, with ordinary eye, kidnap anybody? When we think about it, they take all sorts. They take urine. They take all sorts. They have access to these things. And early detection and prevention of this behavior will reduce the prevalence and the impact of substance abuse, disorder, addiction on individuals, families, community, and the world at large. And I would also want to encourage us that, sometimes when we have life problems, it's not the alcohol, it's not the sleep. Because some people say, oh, okay, because I have this problem, I need to go and take Lexotan. Because your doctor has once prescribed it, and you feel, okay, because I took it that time, and those things probably went away, you have to take them. No, that is not the best. Please seek help. Talk to people. Find trustworthy people, friends, families, support groups. Talk to people. Tell them this is what I'm facing. But, of course, you have to speak to people who you genuinely trust. People are everywhere. I'm in church. You understand? So walk up to people, tell them this is what you are going through. I would say that substance abuse is a major problem. If you check the data for this year, it's very alarming. You know, children, young adults, adolescents, you know, and of course, results is premarital sex, children, unwanted pregnancies, diseases, sexually transmitted infections, and what have you. So I would encourage us that we please not just take these lessons alone, but take it home, spread it, that you should say no to drugs. Thank you very much.
I think the clap says it all. Indeed, I believe we've all learned pretty much a lot with regards to the presentation from the respective speakers. It is said that health is wealth, and it is cheaper to invest in a pair of running shoes and vegetables than to pay for treatment of illness. So I think this is also something that we really need to take very serious with regards to how we go about our lives. Okay, so without much ado, or further ado, I'd like to call on the respective presenters to please come on the podium for the Q&A session. Please, let's put our hands together as we invite them to the podium. Thank you for the wonderful presentation. Again, I want to please ask us to please send in our questions. We have just a few questions here on the Slido. So whilst we're at this, would also